Okay, so now on to fluency disorders. So we talked a little bit about fluency earlier. When we think of fluency disorders, we're thinking really about what we would commonly refer to as stuttering. And stuttering can take many different forms. So typically when people think of stuttering, they think of those repetitions that might happen when someone's trying to say something. I don't know what to say now, right? That kind of thing. That is certainly one way that stuttering can happen, but there are other elements of stuttering as well. So that would be an example of a repetition. But you can also have something called a prolongation. That's where you stretch out a sound in a word and you kind of get stuck there before you can move on. So you might say, I want to go to school. You could tell that that W on want was prolonged. That's another form of a stutter. And you could also have something called a block. And when you have a block, you can't get any words out at all. You just get stuck. And there might be some tension that's associated with that too. So it might look like this. I want to go to school tomorrow. So they're just having trouble getting anything out. They're blocking. There can be other characteristics associated with stuttering as well. So there can be lots of muscle tension that happens when you stutter. It can look like there's a bit of a struggle to get those words out. And fear and anxiety also often are connected to stuttering too, because obviously stuttering has a lot of social implications for many, many people. And when we start to see some of those other characteristics associated with stuttering, that's when we know that the impacts of the stuttering are a little bit more severe and that person is being impacted in a much bigger way. You'll learn a lot more about this later on in term. Often we don't know what causes stuttering or fluency disorders. We're just not really sure. Treatment is really, really important. And with treatment, people can do really, really well. They can learn a lot of strategies to help them control their disfluency. It's important to remember that a certain amount of disfluency is normal. And so in kids, actually preschoolers will often go through a period of normal developmental disfluency as their language is expanding. They'll often start a lot of their sentences and then need to revise it. They might say the same word a few times in a row while they're getting the rest of their message organized. They're almost kind of thinking faster than they can talk. And so sometimes if you see some stuttering in those early preschool years, kind of around the age of 3, 4, sometimes that can be expected depending on the kinds of disfluencies that you're seeing. In adults, there are also normal disfluencies. So even as I'm talking, you'll hear me use filler words like or ah. You'll hear me hesitate if I'm thinking about what I need to say. You might hear me repeat parts of my sentences or phrases as I'm getting organized for the rest of my message. And sometimes you might even hear me prolong a sound here and there. And all of those instances would be considered normal disfluencies. So everyone has some amount of disfluency all of the time, especially if we're tired or stressed or overwhelmed, excited. Those kinds of things can increase the normal disfluency that we might usually experience. If someone stutters, it means they're having more difficulty beyond what you would expect from normal disfluency. So voice disorders can have many causes. They can be related to disease, trauma, allergy, different neuromuscular or endocrine disorders, some congenital conditions. And if you have a voice disorder, that could sound like many different things. You might sound raspy. You might not be able to talk at all. Your voice might sound really harsh. You might have trouble controlling your voice's pitch, or your pitch might be too high or too low. All of those kinds of things might be something you would see with voice disorders. Some other causes that might be common include vocal abuse. So if you're someone who yells a lot, screams a lot, or sings really loudly, that can contribute to you getting a voice disorder. And there are some habits that also interfere with how we would normally use our voices. So if you have a lot of muscle tension in your throat, if you are coughing a lot or clearing your throat a lot or smoking a lot or drinking a lot, all of those things can impact how you sound. I'm sure everyone has seen, an example of someone who has a raspy smoker's voice, even if it's just in a movie or something. Often there is something wrong with your vocal folds that's causing the voice disorder. So you might have polyps or nodules or ulcers on your vocal folds, and that can contribute to the disorder. You'll learn more about that later. Voice disorders are certainly more common in certain occupations, typically occupations where people are talking loudly for prolonged periods of time, usually to combat the noise around them. So teachers, singers, and fitness instructors are definitely more prone to voice disorders than other people or other occupations. There are some good examples of speech disorders in popular culture. So here are some celebrities that you can look up if you want a little project. You could maybe see if you can guess what speech disorder they may have experienced. And if you do a quick Google search, you will quickly find the results. So hearing disorders are something we haven't talked about yet. There are several different kinds of disorders that can be related to hearing. So probably being hard of hearing is one of the more common ones that you might think of. Remember that we need to be able to hear in order to communicate successfully. People who are hard of hearing still are getting most of their information through their auditory system. They don't need a ton of other supplementary means of communication. So if you're hard of hearing, you're typically relying still on hearing instead of on a system like sign language. Hearing loss can be temporary or permanent. It can have many causes, including disease, injury, or just becoming more elderly. It can have huge ranges in severity, from being very, very mild, you might barely notice it, to being so severe that you need to have hearing aids in both ears and an FM system when you're talking to other people. So this can look very different for a variety of people. Hearing loss can happen in just one ear unilaterally, or both ears, which is called bilateral hearing loss. And it can be conductive, sensory neural, or mixed. And you should definitely look at your text and fully understand what the differences are with those kinds of hearing loss. That will come up again in your audiology lecture later on. Auditory processing disorders are something that can happen in people who have normal hearing. So their actual ability to hear sound is still normal, but for some reason they have difficulty understanding speech and making sense of speech. They have trouble processing that auditory input. And they may have trouble keeping up with conversation, understanding speech if it's really noisy, discriminating between different speech sounds, integrating that incoming stream of speech with the nonverbal communication that they're seeing. There are lots of different reasons for this. Often the cause is unknown, but a tumor or a disease or a brain injury could contribute to some auditory processing difficulty as well. Again, the key thing to remember here is that your hearing is actually normal. It's a difficulty with speech perception that's the problem, or how that message is being transmitted to your brain. And then, of course, there is deafness. And when I think about deafness, I prefer not to think of this as a hearing disorder, even though that's how your textbook describes it. I would prefer that we think of deafness as a different ability. Deaf culture is very strong and really identifies strongly with being deaf, and this isn't perceived as a bad thing or a negative thing. It's just a different way of being. So just know that when we talk about deafness in this course, we're not going to conceptualize it as a disorder. We're going to think of it as a different ability. If you are deaf, by the definition that we're using, it means you can't use auditory input as your primary sensory input for communication. You need to use probably sign language instead. Deafness can be congenital or acquired. And there are some interventions that families may choose to pursue to deal with deafness. For example, if their child is born deaf. So they may choose to take a total communication approach. That's where you might teach a child sign language and speech reading, and give them all of that as a way to communicate. You may teach kids to use assistive listening devices. Some families may choose to have their children receive cochlear implants through surgery when they're little, if they were born deaf. And there's lots of auditory training that people who are deaf can also participate in as well to help them develop some spoken speech, just so that they have that as a means of communicating. Just keep in mind, anytime we're talking about interventions for people who are deaf, some people will view those interventions as favorable, and some people will view them as unfavorable or unnecessary, because remember, if we're thinking about deafness as a different ability, then why would you need to intervene to fix it? So that's just something for you to be aware of. There's a wide variety of perspectives as far as how to proceed in those situations. And all of those perspectives are completely valid, and it's all about individual choice and beliefs. Either way though, regardless of what route a family may choose to go, early identification of deafness and early language exposure is really crucial. So if a child, for example, isn't going to receive cochlear implants, then they need to be exposed to a visual language like American Sign Language as soon as possible, so that they don't miss out on that crucial language learning window of opportunity when they're young. Swallowing disorders, we'll talk briefly about here. You need to know that it's something that SLPs do deal with. You'll talk about this more later. If you have difficulty swallowing, that's called dysphagia or dysphagia. And basically what that means is that you have trouble moving food or liquid from your mouth down to your stomach. You might find that swallowing is causing pain, or it might be completely impossible to get anything down at all. It can occur at any age, but is more common in older adults. And again, the causes vary quite a bit. But it's usually related to brain damage, nerve damage, degenerative diseases, or structural problems with the head and neck, like maybe cancer or injuries, surgery, etc. And the treatment of swallowing disorders really depends on what's causing them. So I just want to draw your attention to table 2.2 in your text on page 33. It gives a really thorough overview of all the disorders that might affect people throughout the lifespan. So that's a great resource for you to look at while you're studying. I just want to note here that when we're talking about communication across the lifespan, we really want to get rid of that word normal, because what is normal anyway? So when you hear me talking, you'll find that I'm often using the word typical. So that is the preferred language for us to use. So when we're talking in our interactions amongst our peers and stuff, I want us to keep in mind that let's get rid of that word normal, because what does that mean? This slide is in here to flag the importance of the terms prevalence and incidence. When we're thinking about communication disorders, it's really important that we think about how often this happens to how many people. So prevalence is all about the number or percentage of people in a population who have a disorder at that given point in time, whereas incidence is the number of new cases in a particular time period. And when we think about people who have communication disorders, you'll see in your text, they talk about the normal curve. So remember that if you're thinking about statistics, anything that occurs in the middle of the normal curve, remember I hate the word normal, anything that occurs in the middle here is typical, and anything that occurs towards this lower end would be considered disordered. So if you are, for example, taking a speech sound test and you get a test score that places you somewhere down here, that's a pretty clear sign for us that you have disordered communication. On the contrast, if you score up here, this tells us that you're on the upper end of where you would be expected to be for your age. So how common are communication disorders? They're often, but not always, related to other disabilities. So for example, people with cerebral palsy have a communication disorder. They also have more global motor deficits as well. But remember, we said that sometimes communication disorders happen for no reason at all. And so communication may be the primary area that a person is experiencing a challenge with. Impairments in speech, sounds, and fluency are more common in children, especially in males. And we know that any speech disorder or language disorder that occurs because of a neurological disorder or an injury, those things tend to happen more often in adults. And so I just wanted to give you a few numbers to help you make sense of how common communication disorders actually are. So it's estimated that in Canada, about 440,000 people have some kind of communication disorder. That's huge. That's close to 500,000 people. That's a sizable segment of our population. And then I thought this statistic was interesting as well, that in Alberta, there are 4 audiologists and 32 speech pathologists for every 100,000 people. So think about what that means as far as how many people have communication disorders, how many people exist to help with them. And I think we could argue that there's a very important role for the professions in treating this population of 500,000 people who are experiencing communication disorders in the country. So before we close today, I want us to return to those cases that we talked about at the beginning. So remember, we talked about Bailey and Benji and Marge and Arun, and I asked you to make some predictions about who had communication disorders. And the answer is Benji and Arun. They're the ones who actually have diagnosable communication disorders. As a study activity, what I want you to do is I want you to look at what you know now about disordered communication and typical communication across the lifespan. I want you to go back to their original case information and see if you can figure out, why would we say that Benji and Arun are the people who have communication disorders, but Bailey and Marge have pretty typical communication for their ages? That would be a great activity for you to help solidify your learning from all of this content we've covered today. So here are some myths that we've kind of addressed throughout our lecture today. I won't go through all of these now. These are all things we've talked about already, just summarized for you on one slide. Hopefully you are leaving this lecture with some new understandings of some things that you weren't aware of before. So all throughout this lecture, we've been thinking about, how communication happens, typically what happens when it's disordered. What does this mean for you? Why is all of this important? Because that's really what it all comes down to. I hope that by the end of this lecture, you realize that you are very likely to encounter someone who has a communication disorder at some point in your life. And the more that you learn about these disorders, the better able you will be the better position you'll be in to help them, to advocate for them, to empower them so that they can be more successful in their daily lives. It might make you a better friend, a better child, a better parent, a better coworker, a better ally. Knowledge is power. The other thing I really hope you can remember is that people with communication disorders are people first. They're just people with different needs than you. So when we talk about disordered communication and all the things that can go wrong, it means that those people just need some other supports so that they're able to communicate effectively. And the other major takeaway from this lecture is that everyone, regardless of age, regardless of disorder status, regardless of severity of impairment, everyone needs and deserves access to communication with others. So whether you're someone who has a very mild impairment or whether you're someone who is so impaired that you can't talk at all, you deserve to be able to communicate with other people. It is a basic human right. And we need to find a way to make that happen. And that's our job. Okay, so some really practical tips, things that you can do if this kind of thing comes up in your daily life. If you encounter someone who has a communication disorder, learn about it, look it up. Take on that responsibility onto yourself to educate yourself and to learn about it. It's not always up to them to explain what that experience is like to you. You can read about it and find out some more things first. However, you can also always ask them questions so that you understand their lived experiences. Don't make assumptions. Remember, we said that everyone who has a communication disorder is impacted differently. That's the whole point of the WHO ICF. That's why it exists. We want to make sure that what we are thinking about people is actually accurate for them in their current situation. We want you to be able to correct common misconceptions about people with communication disorders whenever you hear something inaccurate, or if somebody says something derogatory about someone who is deaf, or if somebody maybe assumes that a person with a speech delay has lower intelligence. We want you to be able to speak up and say, well, actually, I don't think that's true, and here's why. We want you to think about how you can support activity and participation in whatever it is that you're doing or organizing, whether that's work-related, volunteer-related, or just even in your family setting at home. And we really want you to be mindful of using language that's inclusive when you talk about people. So remember, kind of avoiding language like normal, making sure that you use person-first language, so people with communication disorders, not, not disordered people or disordered kids or disordered adults. We want to make sure that the language that you use is factual and non-judgmental and positive when possible, because even people who do have communication disorders, they also have a lot of strengths, and we want to make sure that we are able to find and see and utilize and build on all of those strengths that they do have. And I think the other thing we want you to do going forward is just be kind to other people, be kind to people who have different needs than you, or needs that you might not quite understand so well yet. But just take that approach forward in your interactions with the people around you, and it will serve you very, very well. And that is all for our lectures today. I know that was a lot of content. This will be the longest lecture that you have throughout this course by far. Thank you for sticking with us, and we'll see you next time. Bye.